Hey everyone, what's up? It's Dr. Charlie Johnson, physical therapist. Wanted to have a discussion today about the McGill Big Three, which is sort of a buzz sort of topic and or sort of protocol, if you will, within the world of core stability training for people who have back problems, disc problems, SI joint problems, joint problems, whatever it might be. So that being said, this is all prompted by a message that I got from one of my viewers, and this is what they sent me. Dr. Charlie, thank you so much for your videos. They have been so helpful. I've been dealing with herniated disc for the last 8 months with minimal improvement. Your videos have really helped me with pain while sitting. I do have days where I can work from home all day. Lying flat in bed with the lumbar support usually feels best. I try to alternate between standing, lying, and taking a 10-minute walk at lunch. Do you recommend I'm in one position for a certain amount of time if it's pain-free? Give him some advice. He says, wow, I really appreciate the advice and time. I haven't seen too much improvement with it, back problem, and my back is still very stiff and guarded still. Should I just stay away from any core work altogether? And this was prompted by some of my recommendations. So I'm gonna share with you my thoughts on the McGill Big Three and my specific suggestions for this individual. And I kind of give him an idea or some possibilities as to why he's probably feeling stuck. All right. So if you've been strengthening your core and you're just not getting to where you want to go, in fact, you feel stuck and you're not making progress, then this video is going to be super valuable for you. I want you to watch it to the end and pull out the nuggets and begin applying them to your life. Okay. So look, if you're new to this channel, my name is Dr. Charlie Johnson. I'm an orthopedic specialist and a physical therapist, and I help people with back, butt, and sciatica problems heal naturally by teaching them how to use movement as medicine, as well as giving them new mental frameworks as you learn in this video to solve their problem. So look, if you'd like to learn how to solve your problem naturally without pills, shots, or surgery, and or relying on someone else to fix you, then what I'd recommend is you subscribe to the channel, hit the bell for notifications when I go live with new content every single week. So let's get right into it. All right, so here are the messages from this person. And I just underlined a few kind of key aspects of the message to sort of paint a picture of what this person is dealing with. So they're super excited. They saw my content, right? And they said, look, I've been dealing with a herniated disc for the last 8 months with minimal improvement. I do have days where I can, just so you know I'm here, right? Where I can work from home all day, laying flat in bed with a lumbar support. It usually feels the best. Now we're gonna look here. And I gave him some advice and he says, look, I haven't seen too much improvement with it, basically my back or my problem, and my back is very stiff and guarded. Should I stay away from core work altogether? Again, this is prompted by a recommendation I gave him. You can see I started to say, yep, common with what you're doing. So that being said, look, at the end of the day, the picture is this, okay? You can tell this person is avoidant, right, of things which equal pain at this point, even though they've had them for 8 months. So 8 months is considered to be chronic problem. We do have evidence, good evidence, to show that most people, if they follow the right strategies, right, as well as some time obviously involved in there, get better. 75% of people get better within the 3 to 6 month mark. But in this case, 8 months, this person's still seeing very little improvement. So they're avoidant of their pain. You can see it, they're guarded. I said that somewhere up here, right, and very stiff. All right, so basically, this person is not moving very well, and there's also signs of something else, okay? And this something else is what I would call, again, this is based off like this avoidance concept, the pain-fear cycle. And it basically looks like this. So you have some type of pain, right? And usually it's some type of movement or position, right? And because of that, right, your brain says, ooh, I don't know about that, right? And it becomes afraid. And maybe afraid is a strong word, but fear is a general word to describe some type of anxiety or fear or frustration, right? Or worry or concern about something you're dealing with. So I'm afraid to move or get in certain positions, right? And then because of that, right, you decrease your movement or lower, right, your overall activity, decrease activity. And then that reinforces, because you're avoidant of something, it reinforces that thing which you're avoiding is threatening, right? So then there's more fear or frustration or worry or concern, and then movements or positions are more painful, right? And it's just a negative feedback loop that spirals out of control. And it's like, okay, this thing hurts, I'm gonna avoid it. Ooh, I'm a little bit scary. I don't know if I should do that. Is that what I should be doing? It kind of hurts. Maybe I should avoid it, right? Not a good thing. All right, I'm gonna move less. I'm gonna reduce my activity. There's more fear, right? Oh, and now that movement or position it just sort of it sort of strengthens that belief, right? That movement or pain, that movement or position is threatening and should be avoided, right? So this just leads to avoidance, right? It's just a negative feedback loop that continues to strengthen as long as you continue to fuel it, right? So fear sort of, or worry or frustration, right? These feelings that we have about our pain or our problems continue to a lot of times keep the problem alive. And the truth is this, look, at 8 months out, to be completely avoidant of activity and certain motions is probably a recipe for continued pain, because you continue to prove to that thing, again, what you're avoidant of, that it's dangerous. You continue to prove to your system that movements and or positions are dangerous and or threatening, and therefore you keep the cycle going, okay? So just realize this, it all goes back to this. 100% of pain is 100% of the time an output from the brain. And you can either feed it by what you're doing with the body or not what you're doing in the body. So the exercise you are doing, the way you're positioning yourself, the habits or routines that you have in this case, right? And or, you know, the strategies that you're trying as far as it relates to, you know, in this case, McGill Big 3 or core strengthening or whatnot. So in his case, it would be McGill Big 3 would be on the body side of the equation, right? And we're really talking about the curl up, the bird dog, the side plank. Those are the McGill Big 3, basically centered around trying to create more stability within the trunk, right? And then you have this idea of inputs from the brain. And if you have a mental framework that is negative, or there's some anxiety or concern or fear or avoidance, right, at some point, mostly talking about chronic symptoms greater than 6 months. If you've had pain more than 6 months after a disc problem, right, then you start to develop some negative or learned associations with your problem. And again, you continue to feed it, because if you're avoidant of that thing which you're afraid of, right? Imagine there's monsters in the closet, right? And my daughter, let's just say, said, "Daddy, I'm really afraid of these monsters in the closet," right? And she just, and she never goes to check, or I never open the door and say, "Hey, honey, look, there's no monsters in the closet." And she always has that fear or concern because she never confronts it. She ignores it, right? But there's still that idea of like, man, there's monsters in the closet, right? So the idea is that we want to gradually expose yourself to that which you've been threatened by in the past when you get to a certain point. And there's a way to do that, a graded exposure approach, slowly building up in a systematic way to tolerate, in his case, maybe more sitting or doing less lying or more walking or whatever it is he's having trouble with. So, but again, this video is a little bit, I want to now talk about the McGill Big 3 and why I think for him it's become a problem. So I just painted a picture, right, of sort of what he's dealing with. So he's become a little bit of avoidant. You can tell there's probably some fear or concern about what he's dealing with. Clearly, it's probably why he reached out. He's had 8 months of pain. It's longer than what we would expect, right? Normal healing times to be for a disc problem, if that really is what it is. And that says guarded. I know it's hard to read, but it says that he's guarded and he's stiff, right? So you can imagine sort of very protective in his mental kind of view of this. Probably believes that maybe he's somewhat fragile, or again, there's that fear component of moving the wrong way or something like that, for very good reason. It's not that it's made up, by the way. All pain is very real, but you know, he's reinforced that mental framework and that pattern that we've got to break on one side, okay? And then on the other side, right, think of it like this, right? So the McGill Big 3 and or the core sort of strengthening philosophy is based off of this, right? So the theory, there's always a theory or a hypothesis, and then these things become testable, right? So the theory is this, right? So if there's some type of core weakness or lack of stability, or maybe you could say there's too much motion, right? It's another way to say lack of stability in the spine. Then, so if this, then if we do the McGill Big 3 or some other core stuff, right, then we should have less pain. So if there's core weakness, right, and there's a stability problem, then if we increase the stability by doing the McGill Big 3, that insert that intervention, right, or that treatment, then we should reduce the pain. But here's the problem that I've seen with people who take this core stability approach. It does two things, okay? It impacts both the body and the brain. And I think it does it in a sort of negative way. It actually reinforces the negative feedback loop. Okay, so the idea is this, right? So if you have a negative feedback loop, how can you break the negative feedback loop? Well, you can start to change these negatives, right? The negative input from the body, ooh, it hurts. The negative input from the brain, right? This is a constant interaction of, you know, body has a problem or hurts, then the brain says, ooh, I don't know about that, right? And then because of that, right, your body starts to move less, or you start to avoid certain things, right? And then the brain says, see, yep, you can't do that thing, Charlie, right? It hurts. And then, right, so it's just negative, 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 all negatives all around, okay? But what we can do is we can start to say, hey, what if we can give you some motions that feel good, get your body moving in a way that doesn't hurt or isn't threatening, right? Then it tells the brain, oh, that wasn't too bad. Because that wasn't too bad, we can move a little bit more, and now we're more confident. Now motion doesn't hurt, blah, 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 and we switch something that's negative to a positive. All right, so we can either give positive inputs to the body, or better yet, we can give positive inputs to the body and the brain. So we can change the mental framework around how we approach this. But here's what the McGill Big Three tends to do for people. So in this case, again, you're dealing with somebody who's guarded and stiff, right? So I asked him to make sense of this question. I said, look, if you feel guarded and stiff, then, if then statement, does it make sense to do something that makes you more guarded and stiff? What does he mean by that? Well, the McGill Big Three, right, is essentially teaching your body the absence of motion, right, to keep it more stable, more guarded. But here he is saying, I feel kind of guarded and stiff, right? The idea or the theory, again, is that we have lack of core stability, right? Then, this is the reason we have pain, these micro movements within the joints and things like that, right? So it does two things. Every time, right, he does the McGill Big Three, what does it tell his brain? It tells his brain this: body, weak, unstable. I need to do this, oops, spelled it wrong, to get more stable. So then it tells the brain, ooh, you're doing this thing, you're giving it energy because you're focusing on trying to make this thing stronger, give yourself more stability and going down this kind of approach, right? Because you're seeing things through this lens, right? Ooh, maybe you're right. Maybe I am weak and I should be a little bit worried about moving certain ways. Maybe I should be more guarded and protected in my life. And then it tells your body, hey, body, move less, tighten your core, be more stiff, be more guarded. Oops, that's not negative, right? And then it just reinforces that concept, right? By having you, be more worried, be more hyper vigilant about the way that you're moving and the way you're doing things. And again, it cycles out of control and it's all negative. All right, so McGill Big Three, right? Doing this physical motion ties in directly, right, to the kind of psychological perspective that you're taking as it relates to your pain. You're doing core stuff because you're weak, right? And your core is unstable. That's why we're doing it. Otherwise, why would we be doing it, right? If you go by that sort of idea. So because you're taking that approach and abiding by that theory, right, when it comes to solving this problem, then it tells your brain, ooh, I should be a little bit guarded and worried about this, right? And it just cycles out of control, brain, body, and it's negative input, okay? In the case of somebody who is saying, I'm guarded and I'm stiff and I've been sort of avoidant with my lifestyle, Charlie, I'm still laying down and it's 8 months later, oh my gosh, what do I do? And they have some hypervigilance and pain and they're catastrophizing. They have some type of worry, concern, or fear about, am I gonna be able to get back to life? I want them, let me ask you this. Do you want that person to move more and feel more confident in motion, or do you want that person to clench up more and move less? This person needs more motion. Okay, so instead of going ahead and tightening your core and being guarded, right, and doing something, right, because it doesn't make sense. If you're stiff and guarded, why would you go ahead and make yourself do exercises that make you more stiff and guarded? It's just making you more protective mentally and physically in the way that you live life. And if you live life like that and you're avoidant of things and you have some type of fear or association that's negative, anxious about it, worried about it, concerned about it, frustrated by the fact that you can't move or do things, right? This is going to actually turn up the volume on the sort of psychological side, of the brain side of pain, as well as restrict your motion. Because if you're unstable, then you've got to be careful how you move, right? So let's just reinforce the body that we need to be more stable and we need to stiffen up the core. Okay, so if you make yourself too stiff, I'm not saying that you can't do. I told him, hey, look, if McGill Big Three or core stuff feels good, it's a yummy motion. It's all I care about is that you give some yummy input to the system to break this pain fear cycle, right? Then great. But if it's something that's continuing to prove to your body and give more evidence, right, and continue to reinforce this idea that you are weak and that you are unstable and that you need to be cautious with how you move, then you will continue to be guarded and stiff for as long as you continue this. So stop. Stop doing core stability. Stop doing McGill Big 3. Instead, find simple ways that you can start to move your body in a way that feels good. Just give it good input. It might not even matter what it does. Like, hey, you love walking? Great, go do more walking. Can you do push-ups? Cool. Can you twist your trunk to the right and twist your trunk to the left? Right? This is where people say, oh, I can't do that. I heard that was bad. But look, if you're avoidant of that thing, right, that you want to get back to forever, then you'll never get back to it. If you avoid the monsters in the closet, it's cool for a while until you need to go back to the closet. And then you're scared. Right? But if I slowly open the door every night and say to my daughter, she's 4 years old, by the way, Cameron, super cute. I'd say, hey, look, babe, there's no monsters in the closet. Oh, Dad, okay, cool. I don't have to be so scared of that. Okay. Now the next day, see, there's no monster in the closet. Eventually, right, she feels comfortable going into the closet, right? You'll feel comfortable if you can gradually, right, start to get back to activity and start to introduce motion that you were previously threatened by, which might be, Charlie, I'm afraid if I bend over wrong, something's going to happen. I understand. I get it. Okay, makes total logical sense. In the beginning, when symptoms are really hot and bothered, yeah, you might want to avoid that. But at 8 months out, you've got to be careful avoiding that, because the avoidance of that thing is that which gives it more energy and proves that it's a dangerous thing. And it'll continue to strengthen the pain fear cycle like a cyclone, right? And so you've got to jump off that and you've got to separate and disassociate from that, okay? So that's my comments about the McGill Big 3 and or any type of core stability approach. In this case, right, I'm going to teach the person to do the opposite of the McGill Big 3. I say, look, forget about stiffening up your core. Forget about sitting up tall and kind of like keeping, protection, right? Here are some strategies you can do such that you give yourself the best chance of getting back to life, right? With as least threat as possible. That's the main goal. It's not to structurally strengthen the core at this point for this person. It's to break the mental, like the brain-body connection, the pain-fear cycle that they have associated with movement, right? And if they continue to stick within this structural approach of let me do this thing to fix this thing or stabilize the core, then it continues to reinforce, right, negative beliefs about what's going on. I'm broken and I need fixing. And they will continue to work on it and they will continue to get stiffer and stiffer. So in this case, I'm going to say, hey, stop it completely. Why don't you just go for a walk? What else do you like to do? Do you like to dance? Yeah, I like to dance. Okay, cool. Do you like to do this, right? Let's find a way that you can do that. So if dancing is made up of this motion and this motion, which ones do you feel safe doing? Notice I said, which ones do you feel safe doing? They didn't actually do it. And this person in this case hasn't done things, say, in 8 months. All right. But I would say, what do you feel safe? That's a brain construct, right? And I'd say, hey, do you think you could dance for an hour or weightlift or whatever? No, I couldn't do that. Okay. Interesting, because they haven't actually done it, right? But their brain, it's passing a litmus test, going through the brain as a filter, and the brain is saying, I don't know, that seems threatening. Whoop, 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 whoop. Pain fear cycle. All right, cool. You think you can do it for 10 minutes? Yeah, I think I could do it for 10 minutes, right? You think you can do it for 20? I don't know. Well, what if you just did arms? Yeah, if I just did arms, I should be good. Good, go do that. That's your intervention. But Charlie, has nothing to do with my back. What about my core? Don't live your life by this. It's a structural explanation for pain. We know pain is both, is 100% of the time an output from the brain, and you have to consider the brain and the body. And the interventions that you're doing or not doing, right? Don't just think that they're just treating the body or they're just doing something in the body. It's also something that reinforces your fear, right? Continues to give fuel to the pain fear cycle, or what you're doing has a sense of, or has the ability to soothe, if you will, your brain and your body with a sense of calmness. Okay, so we want to calm this person's nervous system down. They're stiff because they're avoidant, and they continue to do things which stiffen, right, their tissue. So I know that's sort of a long-winded response, but I just want you to understand that a lot of times people think that we're doing things just to fix the body. I'm not. All right, I'm not saying that things don't work to fix the body, okay? But when I do motion, I simply am doing motion to teach the brain, right, that you don't have to hurt. And when I teach the brain that movement doesn't have to equal pain, and I break that pain, that movement pain relationship, then the body starts to move more. And then the brain says, it wasn't too bad. And then the body starts to move more. You get more confident, right? And before you know it, you have a positive feedback loop. If you understand feedback loops and that your pain is just a negative feedback loop, mentally and physically, right? Then you can start to plug things in and say, is this contributing to the feedback loop? Is it continuing to spiral in the negative direction, or am I starting to plug in some positive inputs and push it in the positive direction? Okay, so hopefully that's helpful. Let me know what you got out of this, because it was a little bit of a ramble, but I just wanted to go into this topic because I think it's super important, so that you can see a layer deeper. You can see things not at just the McGill Big Three. I could care less about what you do. The idea is you're trying to break the pain fear cycle, right? Break the movement pain relationship and teach your brain and your nervous system that you're safe and that it doesn't have to be threatened. All right, so this is how you do it. Hopefully that was helpful. Like or comment below again. Hit subscribe and or the bell for notifications if you want more content like this. Thanks everyone, and chat soon.